This is Chiropractic Solutions with your host, Dr. Christopher Newble from NuHealth Chiropractic in Summerville, South Carolina. Hi folks, I'm Dr. Christopher Newble from NuHealth Chiropractic in Summerville, South Carolina, and this is Chiropractic Solutions. Now in our last episode, we talked about how the body gets in an unhealthy state. Now I want to talk about the vertebral subluxation complex. And this is a very, very detailed study, and I've got a lot of information to show you in a very small amount of time. So we're just really going to touch on the subject today so you have a better understanding of it. But first I have to teach you a couple of medical words. The first one is luxation. Luxation is a medical term that means a dislocation of a joint. So if your shoulder dislocates, that is a luxation. Now, a subluxation is a partial dislocation of the joint. So if your shoulder just partially dislocates, that is a subluxation of the shoulder. Now that can happen in any joint in your body, but when we talk about the spine and subluxations in the spine, we're talking about partial dislocation of the vertebra, because each one of those vertebrae in the spine, any one of the 24, those are all joints, and they can all get subluxations. And when you talk about subluxations in the spine, those are always a part of a complex that causes nervous system dysfunction. Now, there are 5 components to vertebral subluxation complex. There's kinesiopathology, neuropathophysiology, myopathology, histopathology, and pathophysiology. Now, let's take a look at what each one of these means individually. Kinesiopathology, that's abnormal motion and/or position of the spinal bones. This is best indicated by loss of range of motion. In other words, your neck doesn't move as it used to. Your back doesn't move as it used to. A lot of times, there's pain along with this. Your neck hurts when you move. Your back hurts when you move, or you've just got pain in general. That's a good indicator that there's vertebral subluxation complex present. There's also neuropathophysiology. That's abnormal nerve function, and it's best identified by pain or loss of function in other parts of the body. As I said in part 1, your nervous system is the communication system in the body between the brain and everything else in the body. Your muscles, your internal organs, everything is controlled by the nervous system. And in vertebral subluxation complex, you're going to have an interference between your brain and whatever it's communicating with. Could be your heart, your lungs, your liver, your kidney, your digestive system, anything. It's all connected. Then there's myopathology. That's an abnormal muscle function. This is a very, very common symptom of vertebral subluxation complex. It's identified by muscles that are tight and going into spasm. We've all had muscle spasms, and what do? You reach for the NSAIDs, you reach for the ibuprofen, the Tylenol, the aspirin, the naproxen, or you see someone from the medical community and they prescribe muscle relaxants. This isn't treating the cause, it's treating the symptom. To treat the cause, you've got to see your chiropractor. Histopathology, that's abnormal soft tissue function, and that's identified by swelling and inflammation. This is one of the most overlooked symptoms of vertebral subluxation complex, and I have instruments in my clinic that can detect this kind of inflammation along the spine, and everybody who comes into my clinic gets checked for this kind of inflammation. Now, the end result of vertebral subluxation complex is pathophysiology. Not only do vertebral subluxations contribute to improper nerve flow and improper function of the muscles, organs, and tissues that those nerves are connected to, but it also contributes to accelerated degenerative changes of the spine and the body. Bone spurs and other abnormal bony growths. This is all an attempt to fuse malfunctioning spinal joints. And what does this pathophysiology look like? Well, we'll take a look at that on our next installment of Chiropractic Solutions. With me, Dr. Christopher Newble from NuHealth Chiropractic in Summerville, South Carolina. We'll see you next time on Chiropractic Solutions.